So a disc in relation to the spine is the shock absorber or one of the ligaments of the spine. It helps stabilize the spine but also cushion us when we walk or do any kind of impact exercising. With an injury or even with wear or tear over time, that disc can become degenerated. And the disc is essentially a hard cartilaginous shell that surrounds a soft jelly-like center. Some people compare it to a jelly donut. And when that gets injured or squished or an injury occurs, the outer shell can be damaged and sometimes the jelly inside can squirt out or herniate out and cause what's called a disc herniation or a disc bulge. When this happens, it can compress on the spinal cord or spinal nerves, and if that happens in the neck, it can cause things like neck pain or headaches, or even pain that goes down into the shoulders or arms. A lot of times people will come in with shoulder pain and not realize that it is actually coming from their neck. While certainly a lot of people do have shoulder injuries and pathologies, it also can be coming from a nerve in the neck being compressed from a disc herniation. So a disc herniation can really happen anywhere in the spine. There are discs from the very top of the spine to the bottom where it meets the pelvis. And any one of those areas can have a herniation of the disc. Depending on where the disc is herniated, whether in the neck, the mid-back, or the lower back, determines where you feel the pain if it does go into the arms or legs or areas like that. So disc herniations are multifactorial, but certainly can be from an injury. There are people that get in car accidents or fall off of a high elevated surface, and they can have disc herniations that occur from trauma. Generally, people can remember exactly when a herniation happens because it hurts quite a bit, and they'll feel the pain shoot into their neck or arm or legs. But oftentimes it is from a series of events over time and degeneration, but also does involve genetics, smoking, diabetes. All of those play a role in the health of those discs. And when the disc becomes degenerated, it's more prone to an injury. So when a disc herniates once, it can certainly herniate again, even if you get it surgically taken care of. And the reason for that is the disc is injured. From the time you have that first disc herniation, that is no longer a normal disc. And there is more disc left in the disc space that after another injury can herniate out. It's not terribly common for that to happen, but it certainly can. A lot of times when you have one injured disc, there are other discs either in that area or in another area that are also abnormal and prone to injury. So it is not uncommon for somebody to have one abnormal disc and then down the road have another one that causes a problem. Again, related to degeneration, age, and wear and tear over time. So it tends to happen in people who are more advanced in their years, but it can happen really to anybody, even as young as in their teens can get a disc herniation. Luckily that is relatively uncommon, but it could certainly happen. Yeah, certain sports are more prone to disc herniations than others. Certainly contact sports, a lot of bending and twisting can certainly predispose you to a disc herniation. So for a disc herniation in the neck, the main symptoms are going to be things like a headache, neck pain, or pain that goes down into the arms or fingers. If it is severely compressing a nerve, you can also get numbness or weakness in the arm, and it's dependent on which nerve is being compressed as to where you'll feel that and what exactly will be weak or numb. So the pain can be either a numb pain, it can be a burning pain or a shooting pain, and that's really dependent on how that nerve is being compressed, and no two people are the same. Everyone will feel that somewhat differently. A lot of it relates to how that nerve is being compressed and what is causing the compression as to what you will feel and where and why. A lot of people have neck pain and it's not necessarily related to a disc herniation. Certainly if you sleep on your neck wrong, people get what they call a crook in their neck. That is not from a disc herniation, that is more muscular in nature, and that really feels like you'll have pain on the side of your neck or pain when you turn your head. And that's really localized to the neck itself. It's more when that pain is a shooting type of pain that goes down into the arm or into the shoulder. That's when you really start thinking about a disc herniation that's compressing a nerve. More what we call axial neck pain in the neck itself is not necessarily related to a disc herniation, but certainly could be. So for a cervical disc herniation or herniation in the neck, the treatment options generally start with easy things like medicines. And those can be over-the-counter medicines, or if you go to your primary care physician, they can provide prescription medicines, mostly anti-inflammatories or steroids. The idea behind those medicines is to take away the inflammation in the nerve and stop that pain that you get. When the herniation occurs and compresses that nerve, it irritates it and makes it become inflamed and edematous. And the medicines really help get the edema out as well as calm the irritation of the nerve. When those aren't working, there's also some nerve medicines that we can provide that can help calm that irritation of the nerve itself. If the medicines aren't providing the relief, then we try to go to things like therapies, whether that be just physical therapy with exercises or ultrasound or dry needling, and ultimately an injection of placing a steroid right on the nerve itself can calm the nerve down to the point where the pain goes away. All this is really done to provide time for your body to really resorb that disc herniation and lessen the compression of that nerve. If over time these therapies help and then the pain comes back or really don't help at all, then it becomes more of a surgical discussion talking about relieving the pressure on that nerve with the surgery itself. So depending on many factors, there's different surgeries that can be done for a herniation of a disc in the neck. Those can be anything from an outpatient surgery where just the disc is removed and replaced with a cage, or a bigger inpatient surgery where bones need to be taken away and fused together to provide relief and realign the neck. And all of that is really dependent on many factors that really need to be a surgical discussion with a spine surgeon. With a disc herniation, the surgery really would be the same depending on if you come in early or late. Again, the idea behind the treatment is to really allow your body to do most of the work itself. And really only if your body's unable to do that would surgery even really be needed. And that doesn't necessarily need to be at a week, 2 weeks, or even a year. It's really dependent on the person to when they say they've had enough of the pain and their body has been given a chance to do the work and it hasn't been able to provide the relief that they want, where surgery really becomes indicated. So an X-ray is generally where we start, and that is not necessarily going to show us the disc itself or the herniation, or even the nerves for that fact, but it will show us the bones and the alignment of the neck, which can give us a lot of clues as to what may be going on. The next step to really see the nerves and the disc would be an MRI, but that is usually not needed because in the time it would take to get the MRI, a lot of people end up getting better. So we try to avoid the expensive MRI test in anticipation that your body is naturally going to be able to do what it wants to do and take the pressure off of that nerve. In the time that we expect that to happen, we give you the medicines and things like that to hopefully get over that real severe pain in the beginning.